Does anybody think that it's not okay? Okay. Well, if everyone's okay with it, we're going to go ahead and get started. I'm Ann O'Hara. I am the Medicaid Program Manager for the Kentucky Health Information Exchange. On the call with me, we have Tiffany Bryant, who is the KHIE Outreach Lead, who has been with KHIE for a long, long time, followed by Brandy Janot, who is the KHIE Program Manager over Outreach and Direct Secure Messaging, who has also been with us for a long, long time, as have I. So we just want to thank you for letting us join you today. So what we're going to do on today's call, I'm going to give you an overview of KHIE. We'll talk about our new technology platform partner, give you a couple caveats about the data, talk about how the portal can help you specifically with your community, and then we'll segue to the portal demonstration. So quick overview of KHIE. So we are the CHFS agency. So we're in the Cabinet for Health and Family Services, and we create real-time interoperability amongst the EHR systems for healthcare providers across the state. That is a mouthful. So think of us like the superhighway. So we're the superhighway of data. We provide centralized, real-time views of a patient's medical history. So you can pretty much consider KHIE the single source of truth for a patient's care information. So we've been around for quite a while now, 16 years. We rolled out under the Affordable Care Act. What that means to you is KHIE has a very robust footprint across the state of Kentucky. We are connected to 100% of the acute care hospitals across the state, along with their ambulatory facilities. We're connected to lots of standalone ambulatory facilities, federally qualified health centers, community mental health centers, pharmacies, and even some correction facilities. And we're also connected to the National eHealth Exchange. So we have some partnerships established with other states like Ohio, Indiana, etc. So as I had said before, we're in the Cabinet for Health and Family Services, which means that we have sister agency relationships with organizations like, or agencies like Medicaid. And that's the basis of our relationship with you. So just to let you know, hey, whomever just joined, if you don't mind muting for just a moment, that would be great. So,
that's what I'm looking.
Or Tiff, if you could mute, that would be great. Okay, so again, we're a sister agency with Medicaid, and just to let you all know, on a nightly basis, the claims data that's either been paid for by you, the MCO, or by Medicaid itself for that, fee-for-service population is deposited nightly into the KHIE Exchange. We're also a sister agency with Public Health, and in fact, we're the public health reporting authority in the state. So we collect immunization data, syndromic surveillance data, electronic lab, and electronic case reporting data for reportable diseases. We have a strong relationship with behavioral health, and for any CASPR users, I'm not sure if we have any, we also have access to the PDMP information. Okay, so the reason this whole thing is coming about is because we've recently migrated to a new technology platform, which is called CRISP Shared Services, CSS for short, and it's really enhanced our services for you all in so many ways. So one of the benefits is that we're now affiliated with a network of HIEs across the country, including states like, West Virginia, Florida. Another benefit is the new and improved KHIE portal, which we will talk about in just a minute. New and improved event notification services, something that we offered in the old ePartner viewer, but it's just a whole new way of collecting cohorts of data. It really drills down. Tiffany will give you a really good overview of that. And then some of the new event notifications that we have now are preventative screenings for like cervical, colorectal, breast cancer. I know that some of you follow those for HEDIS measures. So if a provider is sending that data to KHIE, you will be able to pull a specific preventative cohort. Couple of caveats before we get started. Historical data, I do want to let you know that the data in the system currently extends back to November of 2025. We are actively loading the rest of 2025 and 2024, and that should be done by the end of the year. And then we are going to be onboarding 2021 through 2023. So all told, by mid 2027, if I can throw any more numbers at you, we should have 5 years worth of historical data loaded. And then for any of you that work with social determinants of health, we are in the process of reestablishing our connections with Connect Resources. Hopefully that will be accomplished within the next several months. We do have some SDOH data coming in. It's based, currently on the ADT data. Tiffany will show you that in just a few minutes. And then finally, I do want to share how the KHIE portal can help you specifically. So first of all, overall care coordination. KHIE aggregates patient health data across multiple systems into one patient chart. Our event notifications will streamline care coordination, and that's through, real ADT tracking. So again, you can track specific cohorts like, diabetes, medically fragile, whatever. Tracking quality metrics such as HEDIS, especially for you behavioral health folks, you'll be able to do that HEDIS FUM7 along with preventative screenings, pregnancy notifications, which we are currently working on, and etc. Will help you assist in identifying care gaps by, merging the clinical with the claims data to, see if people are keeping their appointments whatsoever. We're going to assist with that preventative care outreach by using immunizations and lab data to, see what members have missed, what services are missing. We can assist with improving population health management tracking. And again, we have that SDOH data. I'm almost finished, I promise. So for you chronic care management folks, you're going to have access to real-time vitals, A1Cs, blood pressures, immunizations, to name just a few. You'll have immediate lab results. So you'll be able to see if chronic conditions are destabilizing. And again, you'll be able to track chronic care cohorts, and this is all via our Population Explorer tool that, once more, Tiffany will talk about. You mental health folks, we are in the process of developing a pregnancy notification that you'll be able to track through, once again, our Population Explorer tool. Since we're developing it, I do want to let you know you can still actively do it, actively track those folks via entering ICD-10 codes. So there is an option for primary diagnoses. We can also assist with HEDIS measures. I said behavioral health. I meant maternal health. I was wondering why I was talking about pregnancy notifications and saying behavioral health. I mean, I guess it applies too. But we're also going to help with the HEDIS, those prenatal care metrics, immunizations, hypertension, again, behavioral health, and SDOH once that Connect Resources link is established. And finally, behavioral health. We're going to assist in providing real-time ADT alerts for those psychiatric patients. Again, we can help follow up after hospitalizations for that mental illness, that FUM7. We can assist with crisis stabilization, comorbidity management, metabolic monitoring for kids on antipsychotics, and SUD data. I will say SUD is the only population that needs to provide individual consent to KHIE. Everyone else, we fall under their business associate agreement. So at this point, I will turn it over to Tiffany so that you can see our portal in action. Tiff?
Thank you. Thank you, Anne. That was great. That was a wonderful overview. So hello everyone. As Anne mentioned, I'm Tiffany Bryant and I'll go over the KHIE portal with you all. So I'll just turn my camera off just so we can focus on our training here, and I'm going to share my screen with you. And so right now what you're seeing is the KHIE portal. This is your landing page when you first log into the portal. Put your ID and your password in. This is where you will land. And there's several different features here on this page, and I'll just go through them briefly with you. So we've got your My HIE admin here feature. This will tell you your admins within your organization should you need to reach out to them for anything. Send feedback. So this feature, of course, is here for you if you need to contact us in any way. Give us any feedback. If you have any questions, please feel free to do so here within this form here. But please remember, do not submit any PHI information via this form. There is a separate form within the patient's chart, and at that point, it would be secure for you to do so there. Product updates. You'll just find any updates that are going on here. And then if you click on your name, you have a couple of different options. You have the ability to change your password should you need to do so. And then you also have the ability to log out. And then you also have just a standalone logout button here as well. Also keep in mind, the system will automatically log you out after 30 minutes of inactivity. So just keep that in mind. Then down below, we have your Population Explorer module. This is a module where you'll be able to view and filter your event notifications and all those things that Anne was talking about earlier, that if you needed to monitor or look up, pregnancy, I'll show you how to do that there within the Population Explorer module a little bit later in the training. And then down below here, you have your dashboard, and this is where any other applications that you have access to, you'll find those here under your dashboard. You will also see the user guide here. You can access your user guide from here as well quickly if you need to do so. And then lastly, we have our patient search. So we'll go ahead and search for our patient. We are in our testing environment. I will warn you of that. And so our test patient, his name is Gilbert Grape. And so the first name, last name, and date of birth, these are the 3 required fields. As you can see, there is the little red asterisk next to those fields, just reminding you those are required. If you know the gender and social security number, please feel free to pop those in as well. So we'll go ahead and search for our patient. And so right now, what's happening, of course, is the system is going out. It's looking for the data on Gilbert Grape, any matching patient's information. It's going through all of that. So with that being said, you can see there's several different Gilbert Grapes that have populated. This is because he is our testing patient, and so they use him for several different scenarios. So he is in our system, several different times for that. But one thing I do want to point your attention to is this match score, and this will help you determine the correct patient. So you can see here our Gilbert Grape. We know this first Gilbert Grape here, he is the one we're going to be using for our test and our training today. But he has a score of 117. That gives him a score of a probable, and there is 2 other scores, possible and exact match, that you would see as well. So just keep that in mind as you're going through and looking for your patients. So once you determine your patient that you want to view information on, you'll click on that patient's name, and I have a couple of different options here. This consent tool, I'll just briefly touch on it just because it's there. The consent tool, that's something for those 42 CFR Part 2 participants that's dealing with having to get that special consent for those patients. But I don't think you'll have to deal with that. So I just want to touch on that just because it was there. But you'll click on clinical information. And so now the system's going out and it's pulling back all the information specific for our patient, Gilbert Grape. And you can see here to the left, you have your reports and applications. So this is just another way that you can go into those applications should you need to do so. And okay, so this is a good thing that has popped up here for me to explain, a good example. So this is what's called our breaking the glass feature. And so this is just a little added extra security. A good example would be like an OBGYN office. If one of their providers are looking up a male patient that's not on their patient list, it kind of pops up and says, "Hey, why are you doing this? We need to know, exactly what you're needing to know about this patient. Why are you needing to access this information?" So you'll just click proceed, And then you'll choose new patient, treatment, care coordination, quality improvement, or public health. So you'll just need to kind of give a reason as to why you're needing access to this patient's information, whichever one correlates best to the reason you're needing. So we'll choose care coordination. Um, and we'll click submit, and then now you'll have access to that patient's information. So again, it's just an added security feature. If you're looking for a patient that happens to not be on your patient panel list, it's just going to ask you, hey, why are you needing access to this information? And so again, we're in our testing environment, so the system is just kind of loading up for us. And we will just collapse these additional reports and applications here to the left just to give us a larger viewing area. And one thing that I like to do is I like to expand our menu over here just so that it gives us a brief description of each of these items. But we'll just kind of work our way down the chart here. You'll see the blue ribbon here just gives you basic patient demographic information. Again, just ensuring that double checking that you are looking at the correct patient. And then down here to the right, you have your priority alerts with this white bell. And if you click on that, it's going to list these alerts. And these are your clinical alerts or your infectious disease alerts. So, for example, if your patient were to have like MRSA, that would be listed here as an alert for you to view. And then there is the three little dots or this ellipsis here. If you click on that, there's a few different options. You have feedback, and this is the feedback form that I was talking about earlier. If you have any type of feedback that you need to submit that includes any type of PHI information, you can do so here. And it would be secure at that point. So you would just select the type of feedback, pop in those comments or suggestions here, and then submit that form, and it will be submitted so that we can help you resolve any issues you're having or answer any questions that you're having or review any type of feedback you have. And then next is the glossary of terms. Again, it just gives you a brief description of some of these menu items. Here you can see just a brief description of different terms that you'll see throughout the patient's chart. All right, so we will come back over to our menu of items here, and we'll just go through each of these in order. So I'll go back up to patient information. This just gives you your patient's demographic information listed here, should you need to access that. And then you have next of kin information here to the right. If that information has been submitted, it will display there. And then next we have clinical data. And you can see here under clinical data, there's several different tabs here at the top, and we'll go through each of those. I did want to address this school attendance data here. This is something that Washington, D.C. uses, but due to FERPA regulations here in Kentucky, we're not able to offer that information. So again, this is our testing environment, and this is something that shows there. But again, you won't have access to that, in the live environment. I just wanted to address that just in case there were any questions about that. So we'll go up to our different tabs here, and we're already in health records. And you can see down below here that within the health records tab, that includes your labs, radiology, and your clinical notes. Right now we're in the all tab, so that will include information from all three of these different tabs within this one tab. They are all listed here for you to view if you want to view them in that manner. You can search and filter through through all of these categories here as well. You have the opportunity to hide your own organization's data. Here's your search feature. So if you needed to search for something specific, you can see here to the left, your search bar has populated. So if you wanted to search for a CBC, you can pop that in there, and you can see now that only those CBC labs have populated here. And if you're done, when you're done with your search bar here, if you wanted to close that out, you could, or you could leave it up if you use it frequently. You have this view columns option. So if you wanted to hide any of these columns, your date collected, source, category, or so on, you could do so by unchecking the box here. And then when you want to repopulate that back, you'll just recheck that box. And then next is your filter table. This does give you the ability here to filter through several different options here. So the first one is by date. So if you know you're only looking for information for specific dates, maybe for the last 3 months of data, you can pop those dates in there and the system will go out and only populate the last 3 months of data. If you wanted to drill down even just a little bit further and you knew a specific location, like a specific source that the information is coming from that you're looking for, you can filter down just by the source. You can also filter by your healthcare enterprise, your category. If you know you're just looking for a lab, you can filter just through your labs. And then also, if there's a specific provider that you know you're looking for information from, you can filter just on that provider as well. All right, so we'll go through each of these 3 different tabs here, just so I can show you just an example of, what a lab looks like. Again, you have your features here. If you want to search and filter just through your labs, you can do so. But I will open up this hepatic function panel, just to show you how a lab presents within the system. So at the top here, you have your blue ribbon. Again, it gives you your patient's demographic information. Here you have this little down arrow. It gives you the ability to download this report into a PDF should you need to do so. And then you can also navigate through your other labs with your arrows here. Then down below in this gray box here, you have the description of the report that you're looking at. So we know this is an hepatic function panel, the source that this information has came from, the provider, and the date collected. And then if you scroll on down, then we get into the meat of the report here, listing all your results of this lab. You can see some of these labs have little flags next to them. This is to draw your attention to that lab. If you hover over that flag, you'll see that this is a below low normal. So again, just to draw your attention to that lab, that this is an abnormal result in some way. So we'll just close out of that. And we'll go into radiology next. And so here we have all of our radiology reports listed. Again, you can search and filter through just your radiology reports here should you like to do so. And right here, I do want to show you this image, this camera icon here. It lets you know that there is an image available associated with this report. So we'll click on our first report here. And again, you have your patient's demographic information at the top here, very similar to how the lab presents. But we do have this extra camera icon along with your ability to download this into a PDF. So if you were to click on this camera icon, either here or back on the other screen, a separate tab will populate and it will show you that image that's associated with this report. Again, you can navigate through your additional reports here if you would like to do so. And we have the description of our report. This is a nuclear medicine cardiac stress test. And then down below is your findings. So we will close out of that and we will move on to our clinical notes. And so here we have all of your clinical notes listed. Again, you have the ability to search and filter through this information as well. All right, so next we have structured documents. And so here under structured documents, this is where you're going to find any CCDs that have been submitted. And so this is the all tab, so this is going to include all of those. Next, we have the HIE tab. And so I did want to specifically explain the HIE tab versus the National Networks tab. So the HIE tab, this is where you will find any CCDs that are being submitted from any KHIE participants or any of those KHIE affiliates that we're now associated with that Ann mentioned in the intro. So you will find those CCDs here under the HIE network. Now, the National Networks tab, this is where you will find any CCDs that have been submitted to us through the National eHealth Exchange. So if anyone is connected to us in that manner and sending in their data through that, then you will find that information here. All right, and again, you have your options to search and filter through these tabs as well. Next, we have encounters. So any encounters, those are listed here. It is broken down between hospital and outpatient. So again, if you know you're specifically looking for a hospital encounter, you can quickly just click on the hospital tab, and it's going to show you only those hospital encounters. Next up is your problems list. So that will be located here with the description, the code, first reported date, and so on. Next, we have immunizations. So we do have a great relationship with the immunization registry, and we have been receiving data from them for many, many years. So here under the immunization registry tab, you will find the immunization registry tab and then the electronic health records tab. So here under the immunization registry tab, this is where you will find any immunization data submitted to us through the immunization registry. You do have the ability to filter and search through this tab as well. And you can also download this information into a PDF as well. And then if you click on your electronic health records tab, this is where any immunization data that's being reported to us from other sources, you will find that here under the electronic health records tab. Again, you can search and filter through this tab as well, and you can download this information into a PDF report as well. Allergies is next. So any allergies that have been reported to us, you will find those here listed. One thing I did want to point out though is this little blue icon. So what this is telling us is that this information has extra protection surrounding it due to the 42 CFR Part 2 regulation, and this prohibits unauthorized use or disclosure of these records or information. So again, just remember, anytime you see this blue shield icon here, this information does have extra protection surrounding it. Next, we have vitals. So any vitals that have been submitted, you will find those here. Of course, you know, you got your body temperature, blood pressure, and so on. It also lets you know the source of where this information was collected as well. Next up is procedures. So any procedures that have been reported and submitted, you will find those listed here with the procedure name and code. Again, if you're looking for something specific, if you think there's a specific procedure that's been done, you can search for that here. The search bar will populate there to the left for you. All right, so that covers everything under clinical data. And if you have any questions, please feel free. I'm not sure. I think we said it before, but if you have any questions at all, please pop those in the chat, and we'll have some time to go over those questions.
Hey,
But
Tiff,
next
it's
is
Ann. I totally
yes.
forgot to say that. So my
Oh,
apologies. We did not say it before. 100% on me. Again, if you have any questions about what Tiff just discussed, you know, under the clinical information or what she will be discussing, yeah. Can we see ER visits? Yes.
yes.
Roberta, good answer, Tiff. And Tiffany will show you how you will be able to see those in our Population Explorer tool. It's pretty exciting.
Yes, yes, I will go over that for sure. But yes, no worries. But again, as Ann said, just pop those questions in the chat and we'll be happy to review those. We will move on to our medication management tab here. And so here we have PDMP and reported medications. So as Ann mentioned earlier, I believe she touched on Casper. So if you're a credentialed Casper user, here under the PDMP tab, you will find that information. You can view those reports here. You have the ability also to download those reports if you would like to do so. But again, remember this information is only for those credentialed Casper users. Now, next you have your reported medications tab. You don't have to be a credential Casper user to be able to review information that comes from these sources. But it does filter within the last 90 days. So the last 90 days is the default. But if you needed to view all, you will just click the all tab and it will list out all for you. Again, you can search and filter through this data as well. And next, we will move on right down our menu items here, which care coordination comes next. And so under care coordination is your care team feature. And so here under this feature, any provider or organization that has a treatment relationship with your patient, you will find those listed here for you. This is going to help you with your care coordination and closing in any of those care gaps as well. So again, just remember here under your care team, under care coordination, you'll find that information. Now, referral history is an option here, but at this time we're not offering this feature, so we'll just skip over that and we'll just move right on to our next menu item, which is social needs data. And so here under your social needs data, this is where you're going to find any assessments or conditions listed. And as Anne mentioned earlier, we are partnered with Connect Resources, and we're still working on this portion of the portal. But this is a good example of what this could look like once that is complete. So here we have all of our assessments that have been completed. And again, here under social needs data, this is going to help us identify any needs that your patients have. So if we click on this first assessment here, we're going to see that different categories here have been flagged, meaning that this patient, as you can see under housing, is flagged. They're having an issue with housing. So this would allow us to be able to go in and say, okay, I see my patient's having an issue with housing. I want to help them with that because that's going to help them in the long run with their overall health. So you could go to the Connect Resources website and put in that patient's zip code, and it's going to pop up any housing authorities in that patient's area, and you will be able to refer them to those resources to hopefully help them resolve the issue that they're having. All right, and then next is conditions. So any conditions that have been identified, those will be listed here. Again, just to help you better treat your patients and helping them resolve any issues, that they may be having that could be affecting their overall health. Next, we will move on to our next menu item, which is data from claims. And so, of course, as you all know, we have a wonderful relationship with Medicaid. And so we do get a nightly download of paid Medicaid claims data. And within that data includes medications, diagnosis, procedures, and encounters as well. So again, just remember that this section here, data from claims, this is only your data from Medicaid, from paid Medicaid claims. So anything that Medicaid or an MCO has paid, you will find that information here, specifically under data from claims. And then next is my patient summary. So this is a really nice feature that will allow you to customize a view, and I will show you how to do that. So we'll come back up to our clinical data here. And so maybe immunizations is something that you're frequently getting into a patient's chart to look up their immunization history. You could pin that by just clicking on that blue push pin icon here. And then maybe vitals is something else that you frequently are viewing. You could pin that as well. And when you pin that, it's going to turn this push pin blue. So that when we come back to my patient summary, you can see that what we have pinned pops up here under my patient summary. So this is going to allow you, when you log in and you search for your patient, you get into your patient's chart and you're just looking for a vital. You can come straight to your patient summary here, and vitals is already going to be populated here, and you can, view and research whatever vitals that you're looking for at that point without having to dig through the patient's chart. It just saves you a few clicks and a little bit of time. And next is user settings. And again, this is another option that we have to customize a view. So your menu items here that we just reviewed, if you don't like the order that these are in, if you wanted to put my patient summary at the top here, you can do so. You would just simply come over and arrow up. Use your arrows here to arrow up and down and put them in the order that you would prefer. All right, so that covers everything under clinical information that I needed to cover. Again, just a reminder, pop those questions in the chat and we'll be happy to review those. And I'll go back to the homepage before we go into the Population Explorer module. And we'll see, is there any questions that we need to address right now before we go into Population Explorer module? Nope. Okay. All right. Well, we'll move right along into the Population Explorer module. And to get into the Population Explorer module, you'll just expand your view here. This just gives you larger viewing area that shows all the features within the Population Explorer module. Again, here, this is where you will be able to view your event notifications and filter those notifications. So the first thing you'll want to do when you get into this module is choose your patient panel. And so we do have a test panel created here. So I've chosen that. And you can see here to the left, all of our notifications that are associated with this panel that we have selected have populated here to the left. Now, right now we are in the detailed view. But if you wanted to go into your table view, you could do that as well. That's an option. It's just, whichever view you prefer to work out of. I will work out of the detailed view, just so that I can go through and explain each of these categories to you. So whenever you determine whichever notification you want to view some more details on, you will just click on that notification, and I'll just click on the first one here. And right now the system is loading up additional details here, like under follow-up status and patient demographics. And so I'll go through each of these. So the first one here is follow-up status. So this is a really nice feature that will allow you to track the progress of any follow-up that you've been doing with your patient. So maybe you have a patient that was discharged from the emergency room and you wanted to follow up with them to ensure that they have scheduled an appointment with their PCP. You could use this follow-up status to help you keep track of that. So if you click on your down arrow here, you'll see there's a few different categories here that you can define. Your organization can define these categories for whatever works best for your use cases. So back to my example, if someone has been discharged from the emergency room and you wanted to follow up with them to make sure they had that appointment scheduled, in progress could mean you've maybe reached out to them and left a voicemail, but you haven't determined if they have that appointment scheduled yet. And then, of course, maybe complete would mean that that process is complete, that patient has that appointment scheduled, and all is well. So again, you can use this for whatever use case works best for your organization. It will also let you see who has made any changes to this follow-up status and the date that they made those changes as well. Next is your patient demographics. So again, this is just more detailed patient demographics listed out here. Your notification details. Because we're working out of an encounter-based notification, we wouldn't have any information populated there. Now your panel details. This is pulled from your patient panel list. So any information that is populated here, it was just pulled from your patient panel and popped here for you to view should you need to view this information. Selected encounter details. This is just additional details surrounding this event notification. So you can see you have your admit date and time and your event date and time. If you scroll on down, you can see the encounter type. This was an outpatient, at the facility name. This is the KHIE demo hospital source. You can see the facility type. You can see your patient complaint and your primary diagnosis code, and the description of that code as well is also listed here. Preventative services. So I know Anne touched on this a little earlier, and that's something that they're still working on. So more to come on that, and that should populate here under your preventative services and give you details there. Next is risk details. So this is another more details that have been pulled from your patient panel list and populated here for you to view. Aggregate details. So this is a nice chart here that lets you know if your patient has had any past visits within the last 30, 60, 90 days or so on as an inpatient, outpatient, in the ER, or an observation. And then your diagnosis details. So this will list your primary diagnosis code and the description, and then also any additional codes associated with this event are listed here below that as well. Your follow-up status history. So this deals with that follow-up status feature that I talked about at the very top here. This is just going to list out all the changes that have been made to that. And your encounter history. This is going to list the last 6 months of encounter history information here for your patient. All right, so that covers everything. That covers all of those categories. So the next thing I wanted to talk about are your options to export data. So the first option is your patient export. So the information that we just reviewed here for this specific patient, you can export that data, just for that patient. And you would click patient export. You would acknowledge that you are exporting PHI. So you would accept and continue. And from here, you will be able to create this report or this Excel spreadsheet for whatever works best for you. You can choose as many of these categories, these fields, as you would like to be included within your report. So if you wanted to include your facility type, maybe, or your primary diagnosis code, you could do that. And there was one other I was going to give an example for, if I can find it, but I was going to say like encounter type. So if you wanted to know, back to the question about the emergency room, if you wanted to know, here it is. If you wanted to know, if you wanted just your emergency room encounters, you could create this report and then filter just for your emergency rooms. You can do that here. There's another filter option that I'm going to show you in just a few minutes as well. But I did want to show you that this is an option as well if you wanted it in an Excel spreadsheet to be able to view, if you needed that in that format.
So
And I do
Tiffany,
have,
oh, I'm so
yes.
sorry. Could you,
Sorry, I
could
didn't
you,
see your hand up.
no. Could you filter it by a specific facility maybe? Like maybe UK healthcare?
Yeah, you can do that. You would click facility, and it's
Okay.
going to, which I don't know with doing just your specific patient export, if that would really help in that report. But when we go to do like the entire patient panel, it would definitely be helpful at that point if you included that within your filter, because then you could filter it within your spreadsheet and slice and dice it there. Ever how, whatever specific facility you were looking for at that point. So yeah,
And
that would be a great option.
you can also do primary diagnosis codes and then add other diagnosis codes as well, maybe? Yep,
Yeah,
there it
you got
is.
your primary diagnosis code, um, the description if you wanted to include that. Um, gosh, there's just so many of them. The provider, if there was a specific provider that you wanted, you could include that. Um, a
And
specific
that's where you would
notification
do,
type.
right. And that's where you would do the preventative services categories right down there.
Mm-hmm. Yep.
That would be for like breast and colon and colorectal, right?
Mm-hmm. Yep.
Okay.
Right here. Preventative services testing. That would be a good one.
So that would be, there's a million ways to slice and dice the data now. So,
Oh, yes.
and WellCare is submitting automatically submitting a patient panel. So that means that you're getting, you'll be able to do notification, or you'll be able to do specific reports on all of the panel patients. So based upon this criteria right here, is that an accurate statement, Tiff?
Yes. Mm-hmm.
Yeah,
Yep.
it's a leading question. I knew it was. I just wanted to, reiterate this is so important. I think this is really based upon what we know of the MCOs. This is
Mhm.
really going to be a great way for you all to track your patients in real time. And I'm going back on mute now, Tiff. I'm sorry.
Okay. No, no, you're fine. Interrupt anytime. It's not a problem. I encourage it. I like for it, like you said, it's interactive. So let's be interactive. um, but the patient export, the one we just did is specific for just that one patient. But then you could come up here to your patient panel export, and this will allow you, again, you got to just acknowledge that you're exporting PHI. And this is where you can export the entire patient panel. So it gives you even more options with that entire patient panel list, if that makes sense. Whereas before you're just that one patient, this gives you all of your patients on your panel that you could select, like we had before, your encounter type. And if you wanted to just know those emergency room encounters, or if you just wanted to know those inpatient encounters, you could create a filter there, filter just your emergency rooms, and then you're going to have all of your patients listed with the emergency room encounter in one spot. You're going to have them all listed on that Excel spreadsheet at your disposal. Whatever you need to do with that information. All right, so I think we've covered everything under export. So one thing I did want to mention before I forget is a really nice little trick here. If you need to go back into your patient's clinical information, back into their chart, so for example, this first event notification here, if you wanted to go into their chart, you would just right click and click clinical information, and it's going to take you back into their chart so that you don't have to go back out to your homepage, search for that patient all over again, and go from there. You can do it straight from here without having to go back out and do that. All right. So I just wanted to mention that because I think that's a really helpful feature here within the Population Explorer. So the next thing that I want to talk about is the quick filter feature. So last but not least, this is like, I don't know, one of my favorite things, really. It's really awesome. So if you click on your down arrow, so all of the options that we have here on our export is also here on our quick filter feature. So the ER example just keeps popping up in my mind. So I'll do that one first. So, because I know someone asked specifically about that. So if you're wanting to know just your ER encounters, you can come here to encounter type. You would click emergency, and you would add that to your filter. And you can see now all of these notifications here to the left are just your emergency room encounters. If you wanted to drill down even further and say, okay, what are my emergency room encounters within the last 7 days? You can do that as well. So you would just add that filter to this filter right here. Excuse me. So we come here. Sorry, I'm going to take a drink of water real quick.
So what she's doing is she's layering the different parameters that you're searching for. So she's layering like encounter type, and you would just hit add. Emergency room, you could hit add. You could do it just as easily for inpatient or outpatient as well. And then are you okay now? Okay, and
Yes,
then, okay,
I'm
there you
okay now.
go.
So
Okay.
sorry. Thank you for covering. Sorry, I got a tickle in my throat and some drainage in it. It just went from there.
Tis the
Okay,
season.
it is. Okay, so as Anne said, we're just going to layer. So we will choose discharge date and time so we could see within the last 7 days. So we have now anyone who was discharged from the emergency room within the last 7 days. Now, again, we're in our testing environment, so there's not any information displayed here for us to view. But, of course, in the live environment, I'm sure you would have lots of those examples. All right,
And you could
so
also do primary diagnosis or diagnosis codes here. I'm
you could
sorry.
layer that if you wanted. Yep. Like your diagnosis code, if you knew that. So, maybe like pregnancy, you could do Z 3409 and add that code, and it would display anyone who had been in the emergency room and discharged for pregnancy. So if they were maybe having some kind of complications or something and had to report to the emergency room, you would be able to view that. You could, all I did there is I just removed that code, and you could keep it or you could add another one. We could do like abnormal A1C. So maybe if a patient is having issues with their blood sugar levels, you could put that in, which is R73. You would just put in that code for whatever you're looking for, add that, and it will show you any patient that has been discharged from the emergency room with an abnormal A1C. Now you don't have to do it just for the emergency room. If you wanted to change your encounter type to inpatient, if someone's been in the hospital for that and discharged, you could do that. Or if you wanted to just remove all of these and you say you just wanted to know any patient that's had an abnormal A1C, you can just filter by just diagnosis code, put that code in, add that, and it's going to show you only patients with an abnormal A1C. So here with this example, we do have some examples here in our testing environment with that. Is there any other specific
How,
examples while we have you guys here on the phone that we could go through?
how about the FUM, the behavioral health, if you don't mind?
Yeah.
And there's one that's automatically embedded in
Uh-huh.
everyone's system. It's a public view. So if you don't mind
It will,
showing that, that would be great.
yeah, it will be down here under saved filters, and it is your mental health follow-up. You could do that if you wanted to review any of those mental health um, diagnosis from here.
Do
If
you
you
need
know
to clear, do you need to clear the codes that are there first?
you shouldn't have to, because down here it's showing us what we have, what's actually populated.
Okay.
Yeah, as long as it's not down here, that means it hasn't been added yet. So, like, if we added that diagnosis code, then it's going to make our changes over here. So that's pretty neat, because we can see now under our mental health follow-up, we put in that diagnosis code of an abnormal A1C. So as you can see, like, the possibilities are endless with what you could pop in here and what it's going to, filter and show you how specific you can drill down. Like, we just drilled down to see any of our mental health follow-up had an abnormal A1C, and it just showed us that we have 2 patients that have that. So that's pretty neat. Um, we could also um, you could also do just a specific mental health diagnosis. If you're just looking for patients that has one specific mental health diagnosis, you could put diagnosis code in and put that specific code in right here, and it's going to just pull just those for you. Trying to think of any
And
other
then
specific examples. Yes.
do you want to show how they can name it? So say we put in here, let me give you a diagnosis code. So let's
Yeah.
do ICD-10, or does someone have an ICD-10 code that they work with all the time? Carla, I know you're new, so I'm not going to ask you, but Samantha, do you have an ICD-10 code that you work with, that a cohort that you work with specifically? And I'm sorry to put you on the spot. I'm going to do, if you don't, I'm going to do schizophrenia.
Yeah.
That would be F20.
Okay. We'll add that. And so, decide this filter. So maybe this is a specific diagnosis code that you frequently use. You can come down here to save current filter and click that, and you can name it whatever you want to name it. Whatever is going to work best for you, you can name that so that you know what that filter is. So that each time you come into Population Explorer and okay, I'm just looking for those schizophrenia diagnosis codes, you would have that filter saved and just quickly click on that and it's going to populate for you. This is especially good for like if you have a real complex filter that you've created that you've worked really hard on, and you don't want to have to, each time you go into Population Explorer, you don't want to have to build that filter again. You've already got that saved. Just click on your filter and you're good to go. So,
Yes. Can you put in
yeah.
multiple filters? Can you put in, or multiple diagnoses, like for childhood and adolescent specific disorders for mental health? It would be like F90 and then F91, F93,
Uh-huh.
F94.
You could add all of those if you wanted to.
Yeah, can you do, let's see, let's say at F91. So all you're doing is hitting add.
Uh-huh. That's all I'm doing is hitting add, and then you'll see it populate down here. And if you want to remove it, all you got to do is click this little circle dash button here, and it'll remove that.
So for the FUM7, you could put in discharge date within the last 7 days. Can you show that with these
Yeah.
diagnoses codes?
So we've got these diagnosis codes in already. So just like Ann said, you would just put in whichever diagnosis code you want, add all of those in, and then you would come back up here and you would go to whether you want discharge or
Yeah,
admit.
discharge. Yeah, discharge.
It'd be up to what you're looking for. We'll do discharge within the last 7 days. And sometimes that's a little, there we go. And so now it's displaying any patient that has been discharged within the last 7 days that has presented with any of these diagnosis codes.
And you could name it as well, so
Yeah.
that you would save it
Yep.
for the
You could
future.
save it and name it whatever you wanted to name it here. Like
Okay.
FUN, you could save. And then when you come back, you can see it's added to our list here of saved filters.
Okay. I know we are almost at time. We're at 1:58. Are there any other questions? If you have any questions, if you could come off mute and ask, we would be happy to help you. Okay, maybe by hitting the react button, do you all think that this will be a useful tool for you, the KHIE portal? Good, good. Well, good. I will say that Tiffany, Brandy, and I, thank you everyone for responding, are here to help. If you hang up and you think, oh, I wish I'd asked about this, reach out. You have our contact information. I believe you have our contact information. I can put it in the chat really quickly. And our job is to make your job a little bit easier. So by all means, please don't hesitate to reach out. We thank you for your time. Can you tell I'm trying to type and do two things at one time? Thank you for your time, and really thank you for your service. What you're doing is great for our, Medicaid population, and they are certainly a fragile population. So anything we can do to help them and help you to make your job a little bit easier. So with that, I will say thank you, and you all have a wonderful, wonderful day.
Yes, thank you all so much.
Thank you.